Все, да, уже 50 минут есть, уже все, начинаем, конечно, да. Спасибо. Good morning. Today we'll talk with you about joints diseases. We'll stop on main pathology of the joints, which more often we'll meet in clinical practice. And first of all, I want to give you characteristic of main joints diseases. Rheumatoid arthritis, chronic autoimmune systemic inflammatory disease of connective tissue, mainly affecting the joints of the type of erosive, destructive, progressive polyarthritis. It's very grave pathology, and if you see on this picture, you see such significantly deformed joints of the patient. Such as rheumatoid arthritis, first of all, affect small joints, joints of the hand. You'll understand how restricted vital activity of the patient and early invalidization can appear. Deforming osteoarthrosis, chronic degenerative joint diseases, starting with dystrophy and destruction of articular cartilage, followed by change of the bone and joint surface and joints deformity. But on contrary from rheumatoid arthritis, deforming arthrosis appears in senile period and first of all affect large joint, and if small joint involved in pathological process, you see not significant deformation. Vital activity restricted, but not such significantly as in rheumatoid arthritis. And last pathology on which we'll stop today, gout. It's metabolic disease which disturbs purine metabolism and pathological accumulation of uric acid in the body with repeated attacks of acute arthritis. Pathology which also accompanied with significant deformation and destruction of the joint. It appears in adult period, but its progression depends from the order of patient living. Patient is provoke factors of this pathology. Now let's stop on the examination of these problems. If you see on this slide, you can see problem with cartilage, which is characteristic for deformed osteoarthritis. Problem, first of all, with bone, which is characteristic for rheumatoid arthritis. And pathological halt of uric acid into the joints with the destruction, which is characteristic for gout. Complaints of the patient with joint diseases. First of all, pain. Pain in the joints has definite name, arthralgia. As a result, patient complains constrained movements. If this problem appears in the morning, a doctor obligatory must pay attention on this characteristic because it is specific for rheumatoid arthritis. Patient feels tender and limited articulation in affected joints. He can see change in its shape. Patients say about deformation, but later we'll see changing of shape of joints, not obligatory deformation. It may be other origin. Patient can feel swelling of joints which restrict their activity. If the disease has inflamed origin, patient can see reddening of skin. He can feel increased temperature of the affected joints, local temperature, which indicates inflammatory process. There are main complaints of the patient with joints diseases. First of all, pain, problem with movements due to deformation, due to swelling, due to inflammation. Let's stop on characteristic of every problem. Arthralgia, pain into the joint. And again, same order characteristic any pain. I'll remember you. Location, character, provoke, relieving factors. Intensity, duration, which is characteristic of pain, and effect of exercise, because main function of joints is exercise. We'll pay attention on some factors which can provoke or relieve pain. Location may be affected only one joint. We are talking about monoarthritis. Two joints, oligoarthritis. If more than two joints, we are talking about polyarthritis. In pathological process may be involved small joints, large joints. They may be affected symmetrically or asymmetrically. У меня сейчас лекция, что-то срочное. Перезвоню. All these characteristics and the different combination helps to clear you and differentiate rheumatoid arthritis, deformed arthritis, or gout. We'll talk about these three problems. Pathology of the joints more rich, but full characteristic you will study on the next courses. We'll ask the patient about location of the pain. I said you with purpose to differentiate rheumatoid arthritis, deformed arthritis, and gout. Small joints with symmetrical affection is characteristic for rheumatoid arthritis. Large joints more typical for deformed osteoarthritis, and specific beginning of the disease from big toe and affection of metatarsophalangeal joints, typical for gout. Later, in any pathology may be involved all other joints, but if you pay attention on the beginning of pathological process, it has specific features. Intensity of the pain. More intensive pain in the gout. Patient cries from the pain, sometimes needed narcotic medicine to relieve pain. Second space on intensity has rheumatoid arthritis. And third space, deformed osteoarthritis. Duration of the pain and its connection with physical exercise and movement is significant information for diagnosis. For example, patient with rheumatoid arthritis said you that pain intensified to the morning. Patient cannot immediately get up and do some manipulation because all his joints constrained of movement, and this patient needed some specific physical exercise to hold functional activity, to come back functional activity of the joints. This patient needed to get up 1, sometimes 2 hours early to be ready to the work, because sometimes needed for specific physical exercise, because in morning movements of the joints significantly constrained. It is specific visible cut of rheumatoid arthritis. In default osteoarthritis, opposite development of pain. Pain intensifies to the evening after daily physical activity and decreases at rest. In morning, patient gets up subjectively healthy, but to the evening he feels discomfort, especially in large joint, knee, hip joints, no, which it depends what joints involved in pathological process. This patient needed rest and opposite direction for this patient from the doctor. For the patient with rheumatoid arthritis, we'll explain him needed every time to do some physical exercise, because any long rest of the joints will be progressive factors for invalidization for the dysfunction. For default osteoarthritis, opposite direction during exacerbation will recommend the patient rest, because any movements destroyed joints surface cartilage, and as a result progresses pathology. Same problem, pain, but due to origin different recommendation. And for the goat is characteristic sudden pain attacks. Usually it appears during night after errors in diet. Usually after holidays, patient take alcohol, patient take different food, especially meat, spicy meat. As a result, he after alcoholic anesthesia he go to sleep, and then at the night suddenly gets up and cries because severe pain in affected joint. I'll show you this picture that you remember and understand. Such severe pain in attacks of gout. We remember it starts from toe finger. You see it's reddish, deformed, enlarged, swelled, because diseases destroy affected joints. Visual signs of disease. Next step of examination. And first of all, we must check functional activity of joints to reveal cause of limited articulation. We can see specific changing of gait of the patient. Some joint disease, especially deformed osteoarthritis, may be seen when the patient only coming in your room. You unknown his problem may be other organ, but you know that he had problem with large joints, because he has specific dark gait. It is characteristic for the patient with deformed osteoarthritis of hip joint. Problem with gait will be of the patient with knee affection. Limited articulation can be explained by ankylosis, when the ligamentum and joints loses elasticity, and some movements becomes impossible and very, very difficult. У меня сейчас лекция, не могу разговаривать. For example, if the affected small joints, patient cannot completely take some subjects because finger of his hand restricted in functional activity. Patient cannot completely flex or relax hand or extremity or lower extremities if the pathological process localizes in elbow or knee. We'll pay attention on shape of the joints. I said you, patient when see any changing of shape can say only about deformation. He showed joints and explained my joints deformed. But for the doctor, change of shape may be result of three different pathological processes. It may be result of swelling. It's more soft, more good for prognosis because we can release inflammatory process and as a result release swelling and activity of the joints completely come back to normal. More grave patient with deformation when the activity of the joints decreases and more significant if the process characterized with defiguration. You see, this hand of the patient completely loses functional activity. Then we can see some specific formation nearest the joints. Tophus, which is characteristic for goat, and rheumatoid nodus, some protrusion nearest affected joints. No, later I'll show you more completely. We can see reddening of the skin over affected joints, which indicates about inflammatory process, and sometimes maybe formatted skin hyperpigmentation over affected joints. It is more characteristic for rheumatoid arthritis and is very bad prognosis for the patient because it indicates about deep significant destruction of the bone and joints. On inspection, first of all, we'll pay attention on articulation, and on inspection we can check only active articulation. We'll ask the patient move with some or other joints. We'll assess visible changing of the joints depending their swelling, deformation, defiguration, reddish hyperpigmentation, or formation specific local deformation. I said you that we distinguish three origins of the change form. Swelling of the joints appear due to inflammatory process because swelling of synovial membrane, sometimes collection of liquid inside synovial sac, we are talking about synovitis, and usually it is a symmetric process. You compare health and affected joints. A fusion in the joint's cavity may be revealed on palpation or with special instrumental method. And swelling of the joints appears due to damage of periarticular soft tissue, periarthritis, or bursitis, which is inflammation joint sac, which actively produce inflamed liquid which hold inside the joint. Sometimes needed puncture of joints to remove this liquid because therapeutic measures non-effective, joints movements significantly limited. No, it is used only for large joints, usually for knee joints after post-traumatic bursitis. We said about defiguration. It is changing of joint shape as a result of the growth changes of the synovial membrane and periarticular tissue. Process from the joints go in surrounding tissue and accompanied with severe, heavy changing of the shape and as a result functional activity. You see significant deformation of the joints due to collection of the uric acid, which is patient with gout. You see defiguration of the joints, which is characteristic for the patient with rheumatoid arthritis, and as a result you see destructive process into the bones, and you see changing of joints, deformation of joint slit, and as a result dislocation, because joint cannot be held in its usual position due to significant anatomic problems. Deformation. It is persistent change of the joint shape due to pathological growth and destruction of the bones, articular, and as a result formation of ankylosis. Ankylosis, it is limited movements of joints. This process may be characteristic for deformed osteoarthrosis when the significantly affected cartilage, deformed joint slit, edge of the bones, and as a result, shape and movements of these joints becomes affected. And specific deformation which appears of the patient with rheumatoid arthritis, which first of all starts from the bone, significant changing of the bone, and then involvement of cartilage in pathological process. Deformed osteoarthritis starts from cartilage, rheumatoid arthritis from the bones. Deformed osteoarthrosis is characterized with pathological growth of bones nearest cartilage, formation specific nodules. We distinguish two groups of nodules: hypertend nodules, which localizes between the terminal and middle joints, hypertend nodules, and Bouchard nodules, which localizes on the base of middle fingers. You see abnormal growth of the bone tissue with formation of nodules, Bouchard and hypertend, terminal hypertend, middle Bouchard. Each is characteristic for deformed osteoarthrosis. You see visual deformation, cosmetic defect, but functional activity slightly restricted but prevented. Patient able to do some manipulation. Rheumatoid arthritis, more heavy deformation because it's accompanied with defiguration and combined process deformation and defiguration, accompanied with subluxation, ankylosis, and formation specific shape of the affected cartilage and bones. First of all, this process localizes on upper extremities, on the palms of the patient, and has a specific name, and are visited cut of rheumatoid arthritis because it is characteristic only for rheumatoid arthritis. Specific deviation of the hand in the ulnar direction, which resembles seal's fine extremities, and it is named seal's fine deformity, Seale's fine deformity. Specific flexion contracture of proximal and hyperdistension of distal interphalangeal joints, buttonhole deformity. Functional activity of these hands such significantly restricted that patient cannot brush himself independently, patient cannot eat independently, patient cannot take some subject and hold it because such significant deformation. Swan neck deformity of the finger. When the contracture is complete local elasticity of ligamentum and joints becomes unmovable. Flexion contracture of the metacarpophalangeal joints with the hyperdistension resembles swan neck deformity. Now let's see on this deformation. It is seal fine deformity, it is bottom fine deformity, it is swan neck deformity. No, you understand functional activity of these joints nearest zero. Also, it is seal fine deformity. Good deformation also has the specificity. No, first of all, it's localized nearest toe finger. And you see, due to collection of the uric acid into the joint destroyed, will be formed specific formation which is called tophus. And you understand this patient cannot go out from the home, only without shoes. Or must be needed specific shoes. Also, deformation of upper extremities finger. You see, each is tophus due to collection of uric acid. Tophus each is specific nodules containing amorphous mass of monosodium urate, each structure of uric acid, which deformed affected joint, destroyed them. Rheumatoid nodes. It's subcutaneous formation, usually on external surface, elbow more often. No, usually it's only cosmetic defect on the movements, it's not significantly act. But tophus significantly restrict functional activity. You see formation of tophus, uric acid into the joints. Then joints inflamed, becomes reddish, hot during torching. After some time, tophus open and its contents removed. It has specific odor, it's discomfortable for the patient. Sometimes needed surgical correction will remove this structure and needed some specific scar to cosmetic effect. Again, I'll come back to plan of inspection of joints because these questions will be given separately on exam. Complaints and inspection. We'll assess articulation, we'll pay attention on shape of the joints and visual changing. And again, we'll go depending of three pathology: rheumatoid arthritis, deformed osteoarthritis, osteoarthritis and gout. Rheumatoid arthritis is characterized with early ankylosis, limited active and passive movement. During exacerbation of disease, joints becomes swelled, skin over affected joint reddish, becomes hot during touching, and we can see hyperpigmentation. I said you it is bad prognosis for the patient. If the attacks of exacerbation repeated, joints deformed, defigurated, and we can see growth of rheumatoid nodules. You understand this process not fast, needed some times. But rheumatoid arthritis is disease which affect younger people, 20, between 20, 30 years old. And you understand before 40, 50 years old, patient can be completely invalidated. Deformed osteoarthritis affect large joints, more often after preceded trauma. It appears in adult senile period. First of all, large joint as knee and hip. It may be as a complication after long-standing walking, some professional complication. If hip joints involved in pathological process, first of all, will be changed gait of patient. It resembles duck-like gait. We can see deformation, but it's not significantly restrict functional activity, on contrary from rheumatoid arthritis. And if we are talking about gout, it characterized with defiguration because active destructive process due to formation of tophus, and during attack we can see reddening of skin. You see reddening of skin due to active inflammatory process. It characteristic only for gout and rheumatoid arthritis. Deformed osteoarthritis, no swelling, no reddening of skin, because it is a process which gradually destroys cartilage and then whole joints involved in pathological process with formation of deformation. On palpation, first of all, we'll check intensity of the pain, tenderness. We can palpate joints to reveal each swelling, deformation, or defiguration. We'll assess overlying skin, which becomes hot on touching during inflammation. We can clear deformation and defiguration. No, you understand, if the functional activity of the joint restricted, gradually muscular atrophy appears. Muscle becomes soft, not elastic, not adequately responds on any excitation. We'll palpate deformation to reveal specific nodules, because in early stage it may be revealed only during palpation because no visible signs. Or we can reveal presence of free fluid in the joints, bursitis, especially on palpation of knee joints, and will assess passive movements when the joints will be moved by doctor without any activity from the patient. But when we'll palpate joints, we'll put one hand on exact joints, other hand on nearest joint, and check all functional activity in different direction, which is characteristic for any joints. And if the patient restrict movements, active movements, because pain or swelling, doctor can reveal limitation due to deformation, defiguration, and ankylosis, which more grave for prognosis. And on palpation, we can feel specific cracking sound, crepitation, which is characteristic for affection of the joint cartilage, which loses its smoothness and elasticity, which only appears patients with deformed osteoarthritis. More objectively, we'll check functional activity with specific instrument, goniometer. When we'll measure activity of the joints, how it may be flexed or relaxed, distance in different direction, and characterize results with angle. Additional method examination. No, first of all, any pathology of joints will examine with X-ray examination. We can send our patient on computer tomography, on image examination. We can use ultrasonography, which also informative for diagnosis. Sometimes needed both ultrasonography and X-ray examination, or more optimal computer tomography. It depends from the joints and it depends from our aim. And sometimes we'll use invasive method, arthroscopy, when we'll introduce apparatus into the joints, especially large joints, to assess whole its structure. On X-ray examination, first of all, we'll pay attention on condition of the surrounding bones to reveal osteoporosis, osteosclerosis, pathological growth of bones, osteophyte formation. We'll assess surface and space, joint slit, because if the joint slit narrow it's explain why limited movement. Maybe revealed some limitation of movement, ankylosis, when the joints loses functional activity, and pathological position, subluxation. Arthroscopy, I said you, invasive method, when we'll introduce apparatus into the joints and with specific glass optic, we can examine inner surface of the joints. First of all, to assess condition of menisc, ligamentum apparatus, we can see cartilage, we can assess synovial membrane, we can take biopsy in case of growth of tumor, for example. Each is arthroscope, special apparatus which introduced into the joints, and through the glass optic we can see all structures of joints on computer or through the special opening. You see deformation, specific destruction of joints. We can see problem with ligamentum. X-ray examination. Rheumatoid arthritis. I said you, if you remember, first of all started from surrounding bones and characterized with progressive osteoporosis. Problem with joint space which narrowing. Specific formation nearest the end of joints, usuration. Changing normal position of joints, subluxation, and ankylosis. Decreased or complete loss elasticity of the joints. You see as significantly change density of the terminal phalanx of bones. Osteoporosis will see problem with joint slit, which normal on health hand, and you see subluxation, abnormal position of joints, comparing with no, and problem with peripheral and metacarpal joints. No, as rheumatoid arthritis first of all affects small joints, we'll send patient on examination of hands or feet, depending on his complaint. You see progressive subluxation, deformation, and defiguration, and osteoporosis, and no normal joint slit. Deformed osteoarthritis also affect joint space, but no ankylosis and no significant osteoporosis. You can see on the X-ray examination, you see problem with slit, but not such intensive process in the nearest bones, and no ankylosis. It is for knee joints. If we are talking about hip joints, first of all, problem with cartilage and joint slip. And on X-ray examination also, you see no joint slit. If no joint slit, no normal movement the joints into its sac. Good. We'll find intraosteal cystoid formation because it results formation of tophi, which accompanied with erosion in the subchondral bone area and osteolysis. And first of all, we'll pay attention on big toe, which is health solid. You see affected solid. You see as destroyed affected joints, and mass of the soft tissue, tophus, uric acid. Laboratory diagnosis. May be informative in active period of exacerbation. We'll find signs of inflammatory process. Usually it is found in blood analysis. We can prescribe specific immunological examination, rheumatoid factors, especially to reveal rheumatoid arthritis, and some biochemical indices, as C-reactive protein, examination of uric acid in the blood, some indices which shows problem with connective tissue, ceremucoid, sialic acid, fibrin. Now let's see how will we change the indices and what index is more optimal for some pathology. I'll remember you will talk today about 3 diseases: rheumatoid arthritis, deformed osteoarthritis, and gout. If we are talking about rheumatoid arthritis, first of all, rheumatoid factors. It's obligatory index. Blood analysis and C-reactive protein may be active only in period of active exacerbation. Period of remission, blood analysis nearest norm, C-reactive protein negative, may be revealed only rheumatoid factor. Deformed osteoarthritis. No specific laboratory indices, only during period of exacerbation. maybe some inflammatory reaction in common blood analysis, maybe increased level of serum mucoid, sialic acid or fibrin, but specific indices may be revealed only on X-ray examination. Good. Uric acid, which is constant factors of GOT. No uric acid, no GOT. C-reactive protein only in period of exacerbation. Depending on uric acid will assess affection of our treatment. We can say about some prognosis with correct dosage of medication. That's all information which I want to give you today. Today is last lecture. We finish lectures material. Now then we will only meet with you on practical classes and gradually prepare to exam. Students which studied in Simferopol can take part in Olympiad, which will be after May holidays. It includes some practical questions. You'll demonstrate practical skills on examination of patient with respiratory, cardiovascular, digestive system. Then will be slideshow when you'll assess visual signs of some pathology and name them and decide some situation task. In successful result, these students can take exam mark early and have free time to prepare for other examination. But Olympiad will be only for offline students. Thank you so much for your attention. Be healthy. Goodbye. I want that you successfully and in time finish our course and continue your studying in our university.